Well, I think what's very important in regards to navigation programs collecting and reporting their outcomes is, number one, they have to measure something. About 50% of our programs, the last time we asked at a conference, only about half of them were actually collecting metrics. So we had a little bit of work to do, that's for sure. But it's very important that they are collecting, again, just a few metrics or maybe just a handful metrics in regards to patient experience, clinical outcome, and return on investment, and really showing, the success or the growth or the performance improvement initiatives that have been put in place. Also, navigators need to be able to articulate the metrics and their outcomes to demonstrate success and sustainability for the navigation programs. The biggest fear I know that we all hold is that, if we don't demonstrate our worth and our success and sustainability, navigation programs may not be around in the future. We've even kind of seen some of this happen during COVID, where some of our navigators have even been put in some different roles, which made me a little concerned. So it's very important that we'll be able to put some metrics in place, report them to the appropriate people, cancer committee, administrators, different departments, but also to demonstrate the success of the program.
Along that same vein that Tricia was talking about, the importance of reporting out the outcomes, take the next step to actually publish your findings. We need to be sharing best practices with our colleagues across the country who are working in oncology navigation to share what's working well. Where are we impacting patient care and patient care delivery and driving quality? Currently, we don't have benchmark data on many of these metrics. So it's going to be extremely important that as programs begin to collect the data and begin to paint the picture of what their story is, that they publish that and share for other programs to learn, as well as begin to benchmark against one another to help drive quality care.
And Danelle, I think you took the words right out of my mouth, just talking about the importance of publication, because navigators need to be sharing their stories amongst their peers across the country. And then again, just like we did with the pilot sites and the case studies within the toolkit, for people to compare to some level, apples to apples. This site looks just like me in patient demographics, in cancer tumor types, etc. So and to the other point too, around continuing to push out into publication so we can continue to demonstrate the importance of navigation. Because again, without that benchmark data across the country, we're limited in what we're able to really show and demonstrate in patient outcomes. So I just strongly encourage navigators to publish, whether it's in Johns or other publications as they move down this journey of implementation of metrics.
I think another element that's really important for us to make sure we take time to have a little discussion around is the importance of when you're looking at measuring a certain metric. How are you capturing that data? Are you using a validated tool? This is critically important as we move forward to build benchmark data, that we're using evidence-based tools for measurement so that we can truly begin to trend what we're doing. If we're utilizing homegrown tools that haven't been validated, we're not comparing apples to apples. So for example, if a program is using an NCCN distress thermometer as their validated tool to measure distress, and you publish your outcomes, that's the validated tool you're going to be referencing, and then programs know how that distress was measured and reported, which is critically important. Tricia, I don't know if you have something else you'd like to add in that same vein around validated tools.
Yeah, and that came up a lot during the study as well too, is that they weren't necessarily engaged with some of the tools because, again, we did want to use evidence-based validated tools. And you also don't change or revise an evidence-based validated tool because that's the only way we're going to get some really good benchmark, and they'll be able to really do some nice work in regards to publication presentation, because these homegrown tools, they're not validated. So, again, like Danelle said, we're not comparing apples to apples. We're not even comparing maybe even fruit. So it makes it very hard. So again, we have to be articulate and be smart and be utilizing evidence-based validated tools with our metrics and the outcomes. And we did actually, that is actually referenced in the toolkit as well.